Good morning. Today we will talk about acute kidney injury, which is a temporary form of kidney injury. It is very different than the chronic kidney disease or CKD, which is slow, progressive, and irreversible in nature and leads to permanent damage in the kidneys. In order to understand AKI or acute kidney injury or temporary nature of kidney damage, we have to divide the kidneys into three different parts. First is what brings the blood supply from the heart to the kidneys. Out of the total blood that's pumped out of the heart, 25% goes to the kidneys. Means kidneys have very rich blood circulation in them. Number two is the kidney tissue itself. And number three is the draining system. Once the kidney filters the blood, makes the urine, it needs a good draining system to work. In order to understand the causes, so first part, the blood circulation. Anything that lowers your blood circulation or blood flow, for example, if you're vomiting, having diarrhea, or bleeding, or losing the fluids, or in burns patients, or skin losses, that can lead to lower blood circulation to the kidneys that would impact the kidney function. Number two, anything that impacts the kidneys itself. It could be any inflammation. We call them glomerulonephritis or GNs, or some part of the kidney is damaged, or there's some blood clots in there, or any medications that impacted the cells in the kidneys. And number three, the draining system. For example, any stones, any blood clots, or any tumors, or any cancer, or impact of radiation therapy from before, anything that blocks the good draining system. Then the workup would include, important part is to understand what are the events that happened before the kidney injury happened. And this is the most common cause our team sees the patients for in the hospital, whether it's ICU or regular floors. The treatment options include understanding what brought the event of acute kidney injury and what were the events preceding to the event. And treatment options, most importantly, is seeing is it reversible or irreversible. And many times it's a wait and watchful method, means let the acute event or acute illness recover, which would eventually recover the kidneys as well. Support your blood pressure, making sure there are no medications on board that could be toxic to the kidneys, and the draining system is doing well, which could be easily evaluated by an ultrasound. And on a follow-up, once somebody is discharged from the hospital or somebody is recovering from the kidney event, it is very, very important to follow up in the clinic with a regular kidney doctor or at least with your primary care physician.